Hi everyone, I'm Dr. Srikanta J T, consultant, Interventional Paediatric Pulmonology and Sleep Medicine, Aster CMI Hospitals, Bangalore. Today I'm going to talk to you about viral induced wheezing. What is viral induced wheezing? Why are we seeing such high number of viral induced wheezing? What is recurrent viral induced wheezing? And what do we do there? What do we do or what do we treat them with? So first and foremost, what is viral induced wheezing? A child absolutely normal until starts preschool, gets a viral infection and starts wheezing with a viral infection. That is called as viral induced wheezing. Colloquially, it is called as viral congestion, VALRI, that is called as wheeze associated LRI, or sometimes they are also called as probably prerequisite of asthma. But what I need you to understand is preschool children have very high tendency to develop viral infections because preschoolers have not had any infection until up to preschool, as well as no immune system for them to protect them from a viral infection. So it's extremely important that we understand that when a viral infection affects their breathing pipes do become narrow, and any child less than 3 years, there's a 50% chance to wheeze. So it's a very huge chance, isn't it? If I take 100 children, preschool wheezers or preschoolers, 50% will wheeze with a viral infection, which is fine. So what do we do in that? How do we diagnose it? So again, history is going to be extremely important. School gets a viral infection, fever, cough and cold, has a cough, comes to us, we put a stethoscope on the chest and we can hear this whistling sound. Or sometimes parents are very smart. They do come and tell us that this is a whistling sound that we've been whistling. So that itself reiterates to you this is viral induced wheezing. The first episode of viral induced wheezing, we usually tell you that it is nothing that you need to be worried about. Just sit tight, wait and watch. We'll prescribe you sometimes inhalers and if parents are not very open to inhalers, we tell them because it's a first episode, you can even take nebulizations. But are you supposed to get really worried about viral induced wheezing? No. The reason being, one episode of viral induced wheeze is not something that anybody should worry about. But at the same time, if your child comes to us with recurrent episodes, what do you mean by recurrent episodes? Imagine your child has wheezed today because of a viral infection, fever, cough, cold. Until next 3 weeks, child is absolutely fine. Again, next month, child gets another viral infection, again wheezes. And again, a month after, again wheezes with a viral infection. And all the 3 episodes are associated with fever. We call that as recurrent viral induced wheezing. And in those children, we do give them a trial of inhaled corticosteroids or inhalers. The reason being, because there is certain amount of airway inflammation, we need to make sure that that inflammation is taken care of. But we are not telling you that we are going to prevent a viral infection, because nobody has that under their control, because your child is going to continue preschool and your child is going to and is bound to have a viral infection until up to 6 years of age. So we cannot prevent viral infection. But can you prevent a viral induced wheeze and its severity? Probably yes. And can you prevent the remodeling that happens with a viral induced wheeze? Definitely yes. And this year we have seen significant number of children coming to us with back to back, goes to school, gets a viral induced wheeze, again goes back to school within a week's time, again comes back. So that's almost every bi-weekly. And in them we have used not only inhalers, we have upgraded their medications and sometimes added on other medications also. And that is purely to not only reduce the inflammation, to also make sure the breathing pipe is taken care of, to not only wheeze so severely, but also make sure that their quality of life is also reasonably well. And most importantly, attend school, which is very important for their intellectual development. So viral wheezings are going to stay. Viral wheezings are going to happen every year between June, July until up to February. Depending on how and why and when your child has it, we need to treat accordingly. And here we give them a trial of inhalers. And children with viral induced wheezing, that is no symptoms in between, absolutely normal, usually do not go on to develop asthma. But there are a subgroup of children who do go on. So those are the children where we are going to tell you that your child has under 5 Vs with high probability, and though those children will definitely get the attention that they need, and make sure that they do not wheeze accordingly. So these all and more can be done in Aster CMI hospitals. So Any concerns and any queries, you can always visit us. Thank you.